In this video, I'm going to show you how to tape an ankle, just a very basic taping sequence for the ankle joint. There are different types of tape. I'm going to use this, which is a rigid 38mm strapping tape. Rigid means it has no elasticity to it. This one here, different type of tape. It's got the adhesive on the back and there is some stretch to it. Probably doesn't matter which one you use, but for the sake of today's video, I'm going to use this one. This one here is a different type of tape altogether, a lot more elasticity to it, probably not going to give you as much support as these two. You can use scissors to cut the tape, or you can rip it with your fingers, up to you. So, before we tape somebody, whether it be the ankle, the knee, shoulder, take a small piece of tape, stick it on their skin, somewhere near that area. So if I'm going to tape the ankle, I'm going to put a little bit of tape here, stick it down and check that in 1 hour, just by peeling it up, having a look at the skin and check to see if there's a red mark there or any blistering or inflammation. Because if there is, there's a chance that this person is allergic to the adhesive and the tape. And if we're using a different tape, different manufacturer, maybe a different glue, you could be allergic to this one or this one. So depending on what you're going to use, do a little skin test just to make sure. If you do get red or inflamed, wash it off with some soapy water and maybe that tape's not suitable for you. Or you can buy a hypoallergenic tape like Fixamol. You put that over the area you're about to tape, then use the rigid tape, and hopefully the hypoallergenic tape doesn't react with your skin. Look at the literature, they often say that it doesn't really matter because this is not sticking on the bones itself. Ideally, to stabilize a joint, we'd like to tape from one bone to the other. That's not possible because we have to tape on top of the skin. And the skin is quite mobile, so whether you use the rigid or elastic, it's probably 6 in one, half a dozen in the other. So this rigid tape can be difficult to tear. Once you peel a section off, the idea is to pinch nice and high, right on one edge, and then it should tear quite easily. So looking down at the ankle here, my first loop I'm going to do is around the bottom of the leg, the lower leg, and this circle of tape doesn't need to be firm. This is simply an anchor. So I tear off a little piece of the tape, I measure the circumference roughly using the back of the tape. So I'm going to get a little bit of overlap there. Tear. And gently over the skin. Now you'll notice because the lower leg is tapered, the tape might not line up. There might be a slight V there. That's perfectly normal. The next piece of tape I use is an anchor. Sorry, this is the anchor. The next piece of tape I use is the stirrup. Stirrup goes from one side of the anchor, under the heel, up to the other side. Tape sticks to tape quite well, but tape doesn't stick to skin very well. So when you do your anchor, make sure the tape sticks on some more tape. Now this tape needs to stick onto the anchor. So measure it up. Doesn't matter if you go a little bit over. Tear off. Place it on the heel. And then hold it there, pull up both sides, tape onto the tape. Once you've got those two attachments firmly down, you can pat down the rest. The next line. Okay, start on the inside, come around, underneath the heel, and back up. This time, instead of starting on the inside, I'm going to start on the outside. start on the outside, come across the ankle, under the heel, up the other side, and back to that spot. So notice everything I do starts and finishes on the original anchor. Now all these ends of the tape have come to one point, so to stop them peeling off, one more anchor, but nice and lightly, just to hold the ends of the tape down. Remember, this tape needs to come back onto itself because tape sticks to tape well. That's a basic ankle taping. You can double up certain sides depending on if you have a lateral ligament strain or a medial ligament strain. There are other tapes that can come underneath the arch of the foot to help support that, like a low dye tape. But in order to simply help to stabilize the ankle, that's sufficient. Now have a look at this. Can you see how the skin moves a lot? Well, I'm not moving the bones, so the tape is not stabilizing the bones. Some of the theory behind this is that the tape pulls on the skin during movement, and the pulling sensation on the skin sends a message to your brain and tells your brain to be more aware of this area. And the increased awareness helps with the control of the ankle, rather than the tape really controlling the bone. Thanks for watching.